Hi everyone, this is Sachin. I recently went through functional endoscopic sinus surgery, also known as FESS, along with septoplasty and then turbidal reduction. So, as part of that, I have been advised to do some nasal wash. So, one is a regular nasal wash, which is called usually neti wash, or basically put the saline liquid from one nose and then comes out of the other nose. There are plenty of videos on YouTube kind of can give you that information. um, Along with that, there is also another wash called the head low wash. I tried looking around in the YouTube and I couldn't see any videos demonstrating that. So this video is going to be around how that particular process is done. I'm going to be showing the entire step. So let's get started. So the washing process is kind of same for everyone, but the liquid or the prescribed medicine might vary from person to person. So please follow whatever your surgeon has advised. But I think the important thing is you need to have like a saline solution. This is like the base, and you need to that you need to add some medicines. In case of me, this is cephaloxity, which is an antibiotic. You need to mix this with this saline. Again, this is not my advice, this is what my doctor has prescribed, so please follow whatever your doctor has prescribed, but I'm just going to show you how I have been told to mix these solutions. So here is all the things you need: just a box cutter, the medicine itself, and the saline solution. So let's get started by opening the saline solution. Open the cap, box cutter. Be very careful with this. What I'm gonna do is I'm just gonna chop off this top piece and then create like a small hole here, and then take the liquid out. Just ensure there is no liquid here and then chop the head off. You need to mix this liquid inside this saline solution. So I'm just going to dump the whole thing. This is the prescribed medicine from my doctor. Again, you need to follow what your doctor has advised. I'm just going to mix it well, and then I will demonstrate how the washing process is. Basically, I just did a nasal wash, and then now I'm ready for the head low wash. To get started with, to do a head low wash, you need like a bed or a cot where you can lie down. The things you need is the prepared solution like I shown before, and you need syringes. So these are the syringes that I have got without the needle. This is to basically ensure you measure some quantity and put in your nose drip by drip. I'm going to show you that exactly. So I have two sizes because initially when the surgery was done a week back, the quantity of the liquid that used to go in my nose was very low, and only 10 ml or something like that used to go, and then this seemed like an appropriate size then. But after the splints were removed and everything, a good amount of liquid goes now, like let's say 35 to 40 ml. So which means I was in need of a bigger one, so this is like a 60 ml one. You will get this easily in pharmacy. You would also need like a bowl to catch the liquid. I'm gonna show you that, and then some stool or something as per the appropriate height to catch the liquid from your nose. So I'm just gonna set up like this. I have a stool and I have a catch bowl. Just basically poured this liquid into this container so that I can draw it very easily. So I'm just gonna draw 60 ml of this and then keep it ready. And then I have my stool to basically catch the liquid that's being drained. So I have some napkins. This is to ensure this doesn't go into my eyes. So I have my bowl, which is the catch bowl. So I'm just gonna place it here, and this is really important to position this correctly. So first what I'm gonna do is I'm just gonna lie down. So this is the position that I'm comfortably lying down. from here I plan to turn towards my right, so which means the catch bowl has to be in an appropriate location. So it's like I have kept it in a place where it can drain and fall off into the the catch bowl without splashing all over the place. So I just did this check and things are looking good. So what I'm gonna do is I'm gonna take the liquid that is drained from this. I'm just gonna hang back a little bit to tell you the head position. So this is the place where I'm comfortably sleeping on the bed. You will still have to start moving towards the back to ensure the head is hanging. That's the reason why it's called a head low wash. So the level of head hanging depends on your comfort zone. If you have a strong neck, you can lean back even further. I think this is place where I'm comfortable, so this is where the position I'm hanging in. But if you have got lower neck strength or neck pain or any other constraint like that, so you can slightly uh, move forward and give support, but at least 30 to 40 degree is where it needs to be tilted towards backside so that the gravity can pull the liquid to all your nostrils and all the sinuses. So I'm just gonna lean back here. This is where I'm comfortable in. I have my napkin just to protect my eyes in case if something falls there, but I have gotten used to it now, so I don't need to be like putting all these things. Definitely you can take help from somebody else like at your home to pour this liquid. You don't have to do this alone, but I've been doing this over and over and I have gotten used to it. That's the reason I'm doing it alone. So I will start pouring the liquid into the nose. About halfway, and other half. So as the liquid goes in, you will feel that it is getting filled up through your sinuses and all the internal places wherever the airway has made it through. That's a good indication that it is flowing all the places. Especially this is saline plus antibiotics, so all the wounds and everything, the expectation is that it goes and then heals that place. So uh, you just need to ensure that you fill up only to your comfortable. Do not overfill it because it will spill from this and then go to your eyes and all. So leave it for a minute or something. If you start getting this liquid in your throat, little bit is totally fine, but that's the time where you might want to tilt and dump it if you are getting uncomfortable. So I have left it for a minute now. So what I'm gonna do is I'm just gonna tilt towards my right and drain, and I'm gonna also demonstrate how to properly drain all your sinuses. So pay attention. So keep your head in this position. Move further back. You see the sinus is getting drained. Move towards your left. And you see the sinus got drained even more. Move towards your left. Whatever is left in those nostrils will come out from here and then come back to your normal position. In this position, you can choose to breathe through your nose a little bit like this, but do not blow your nose too hard because there will be wounds inside that's not completely healed, so you might see some blood. So do not try to force or exert anything on your nose. Just try to breathe normally, and the purpose of that is to drain the liquid, not to blow through your nose. So I'm just gonna do a quick cleanup. Go back to my position and start putting liquid again. Seems a bit gross, but it is what it is. And again, just lean further, tilt your head towards left, tilt your head towards right, try to breathe, drain out all the liquid. Be patient, let all that liquid come out from your nose. Do not try to blow your nose That's very important. So that's it. That's all how you do the head lower wash. This is very important process. The reason why I'm telling this is initially when I went through the surgery, uh, the quantity of the liquid that used to go in my nose was very low. Doctor had advised me to go through this one of these bottles morning and evening, and if it like 5-10 mls in one go, it was a really cumbersome process. But once the splints were removed on the seventh day, I think it opened up a lot of sinuses and a lot of airway, so a lot more liquid started going in. And the main goal of this is to ensure that your sinuses or the wounds inside get healed very quickly and then appropriately. So do not skip this. It might seem cumbersome, but it's essential for you to do this wash. So I couldn't see any other video demonstrating this. That's the reason why I'm making this, and thanks for watching.